我也当出来宾的。
Hello, good afternoon. My name is Yangdron Kalzang, and I'm one of the organizers for the Encountering COVID-19 through Tibetan Medicine free webinar. So today is our third sessions or part 3. And it is our delight to be back again. And for some of you might have seen for last 2 sessions on April 2nd and April 9th. And for some of you might be new to our program for today. So nevertheless, we will have some reviewing, and we will also answer some of the questions from previous time. So today we're focusing on the on-the-ground work from the healthcare providers, especially 2 Tibetan doctors and healthcare, one of the Tibetan doctors and public health workers in New York City at the high epic areas in the United States. So today, one of our regular moderator is not with us here today, and Tawni Tidwell will be moderating our sessions. Tawni Tidwell is a PhD and Tibetan medicine doctor, as well as research assistant at the Center for Mind. If I said wrong, you can make correction. So I'm going to pass our sessions to our Dr. Tawni Tidwell.
Thank you so much, Yangdron. It's wonderful to be with you all here today. And thank you so much for all of you who have tuned into the previous sessions. So the previous sessions, we're really focusing on how Tibetan medicine understands COVID-19 from the Tibetan medical perspective. So offering some understandings in general of epidemic infectious illness, how the etiology is understood, how some of the diagnostics understood. And this is important to note that this is from the Tibetan medical perspective. We're not saying that we're diagnosing or treating COVID-19 itself. It's helping the wider community understand a Tibetan medical perspective on these issues. And so the first session was really looking at this from a variety of different lenses. And then the second session was going in a little bit deeper. And so today we're going to be going on the ground in New York City, where it's one of the most impacted areas in the US, the most impacted area in the US. And we have 2, one from on the Tibetan medical side, Kunga Wangdu, and also on the public health side, Tashi. So we're going to be hearing from them both today, and we're also inviting all of you to go ahead and post your questions. The form to post your questions has been circulated. If you don't have access to that, you're welcome to post that also on the website from which we're live streaming. And then at the end of our session, we'll go ahead and have the time to ask these our 2 guests these questions. And we will also be having a 4th session on this Sunday, but that's for registration only. And that's for some of our physicians in Tibet, in an Eastern Tibetan region called Qinghai. And they're at the Qinghai University Tibet Medical College. So they'll be sharing the on-the-ground perspective of their experience of COVID-19 there. So please also join us for that at that time. It'll be early in the morning. So this is Sunday morning, 7 a.m. California time, Pacific Standard Time, and then will be aired across all time zones there. So I'm going to start with just introducing to Kunga Wangdu. So Memba Kunga Wangdu was born in Tibet and began his Buddhist studies at the ripe age of 8 and studied Tibetan language and Buddhist philosophy at Drepung Monastery in Lhasa. Memba Wangdu then began his extensive studies of Tibetan medicine and eventually graduated from Mensikang Tibetan Medical and Astrology College in India in 1996. He had the great privilege of completing a year-long internship under Senior Memba Kunga Gyurme, former personal physician of His Holiness the Dalai Lama. And from 1998 to 2002, he served as a clinical practitioner in Tibet medical clinics in Nepal. And currently he practices in New York, Tibetan medicine, and is the vice president of the Traditional Tibet Medical and Astro Association of New York. So I'm pleased to welcome Amshi Wangdu and turn the floor over to him. Thank you so much.
Tashi dele damba jum den de jin ji bo da jum yang da go zo san Megi la ben do we jabola chat celos. Yeah, so this is homage to the medicine Buddha. And first of all, I would like to thanks to Kunde Institute, Atma, and then people who put these opportunities put together to have some, sharing the personal experience to the public. So thank you so much for giving us this opportunity and for all. So first of all, I would like to share the what the Tibetan medicine mentioned in our ancient text about the epidemic contagious disorders, which we call Nyering. So that's the basic things that when we talk about Tibetan medicine, I always like to refer to those old medical traditions or the old the medical texts. So in Tibetan medicine, we have like hundred different medical texts, but one of the most important medical texts we call Four Tantras, Gyushi. So I just want to share you guys, this. So this is the Gyushi. This is the main textbook Tibetan medicine. So this was, it was in history, it was composed by the Alter Yudok Yundem Gombo, and during the King Trisong Tezin, the 9th century and 8th to 9th century between. So this is our main text, which we call Four Tantras. So whenever in Tibetan doctors, when we, go to the college to learn Tibetan medicine, so it is this is the basic, the subject or the basic textbook that we need to learn, and we are not only learning, but we also need to memorize it. So this is called the Gyushi. So what I'm going to talk today is everything comes from the Gyushi. So it's not, I'm not talking about just something new creation or something that comes out from my mind or something that I create. So what I'm talking right now is, everything comes from Gyushi, which is one of the oldest Tibetan medical texts and one of the, the biggest or the most important medical text. So it has like maybe 100 different what they call them other books that explains what the Gyushi says. So in Tibetan medicine, the Gyushi, and we have that's what Gyushi means, Four Tantra, right? The first we have root tantra, and then we have explanation tantra, and then we have oral transmission tantra, and then the last tantra. So those are the Four Tantras. And then in the Nyering, which is like epidemic, the viral infectious disease, was mentioned in the third chapter, third tantra of Gyushi, or the Fourth Tantra. And so this is like 23rd chapter. It was mentioned very much clearly that what we have seen today, but I'm not saying that it doesn't mention COVID-19 or the coronavirus, but it mentions some kind of like epidemic disease or contagious disease that like cause and condition, and then the categories and the signs and symptoms and treatment, especially the cause and condition, and then the signs and symptoms are very much similar. Like I can say like 90% is like exactly same what we have seen today and what was mentioned in the Tibetan medical text. So I just going to read a little bit about this, what the Tibetan the Gyushi says. It says that means when the degeneration era comes, the last part of the degeneration era comes, it's about Buddhist texts. There are like, it's very complicated to explain everything since we have very short time. So I'm going to say when the, the degeneration era means that when the time comes in the future, when the people do the wrong things, wrong behaviors and the non-virtue actions and all those kind of things, that's called the degeneration era. That's what you can consider like that. But there's a lot of countings, if you go deeper. So when the degeneration era comes, and then people, the misconduct or the non-virtue actions, and due to that kind of, because of their greed and the selfishness, and people, doesn't care about the, the things around them, like environment, like we see today, there are a lot of environment issues. We always talked about, like environment is a global warming, and then the cutting trees and those kind of things, like flood, and then we have a lot of like what they call the hurricanes and those things. Those are all because of lack of taking care of environment which is around us. So that's one thing. And then second thing, it's also mentioned, there's another textbook which is the what they call the commentary for this this subject, that's called Hendab. And in the Hendab also mentioned a lot of more details about those, our selfishness nature, because of our selfishness nature or because of our greed, so we destroy the environment, and then we engage with a lot of like that means like chemical things, so many people that says that today, today whatever we see today, the COVID-19 is something to do with the chemicals. Some people says that. So also text mentioned that about things. Even we can see there are a lot of the factories, and there are a lot of weapons, and this, like all those kind of destruction things, like people create a lot of things that are destruction for the humankind, and then also not only for the humankind but also for the environment. So due to this kind of human misbehavior, and especially there's a it also say that especially the the diet and behavior, especially diet, and then also other text mentions that we human being engaged when the degeneration era comes, we engage into the we consume, that we eat something that we are not supposed to eat, and that we don't. So like many research and many people and many doctors and many scientists saying that this epidemic, the COVID-19 is start from the Wuhan, and it because from the food market, and people didn't take care of those like wildlife, or those kind of like people keep eating those things, something we are not supposed to eat. That's also that we have seen today. So it mentions very clearly those things. So when I look this chapter, and then after this one, then there are like five different categories of rim. Then when you move to the chamrim, especially this epidemic, the contagious disorder is very similar to the chamrim. If we move to the chapter 27, it mentioned that the signs of chamrim, and then how to treat the chamrim is very useful today. And in my personal experience, that everybody, maybe some people know, some people doesn't know. In my personal experience, myself and my whole family or get infected by this coronavirus or the COVID-19, and then after taking like some Tibetan herbs, and then doing some home remedies, we've been helped. I cannot say we are cured, but we've been helped. Right now, I don't have any problems, any signs and symptoms, and not only me, my whole family doesn't have any signs and symptoms. So what I use method in our at home is purely I just depend on Tibetan medical texts. So this one, when you look into the chapter 27 Chamrim, and there are like it says that the course of the chamrim is similar to the which I mentioned before, and then there's some specific course also, and then the signs and symptoms. When this one talks about signs and symptoms, it says chamrim goda. It says it has like headache, and then it has like muscular pain, and it has like and then head, what they call the rodu, rodu midi lagan tungyamche, and then the upper back pain, and then we have the leg pain. And most of the time, when we call the doctors, and when we call the clinics, they always ask, "Oh, do you have like leg pain? Do you have fever? Do you have headache? Do you have muscular pain?" This kind of thing. Exactly the same thing is mentioned here. And lagang dungyamche, kaga tangamite, and it's a kind of bitter test, and then we will lose our like appetite, we cannot eat. Then changshumche, that means like shivering. Changshumche means the shivering. And when this stuff in my personal experience also, when I got infected, and I was very much like cold and shivering, like chilling, that kind of feeling. And then it's also says shasu cawa sula shatan milam sasibang, especially when the like evening time comes, like around 7 and 8 in the evening. We call su. That time the fever get worse, and then you will have in the nighttime you have like different kind of like so much like dreamings, different kind of dreaming, something kind of. I also had that kind of dreamings when I wake up. I was sweating very much in the, like that kind of thing. Then and so this is like one part of like, I think if that time it said that if you consume like kind of gur means many people refer as like bitter or the sour taste, but I think it because in Tibet, when we call the gur, and someone says that, oh, this guy likes gur. Gur means like alcohol, gur, alcohol, and or maybe sometimes it's considered as like fermented things, things like. But like fruit and those are sometimes many people ask me, okay, you say that gur and can fruit or the lemon or can orange can harm this one, and I don't think that. I think that this like gur means especially for like alcohols, alcohol is a kind of like fermented, right? So that's things. And then when we go down here, and then it mentions and then how to take care of this one, how to take care of this the nyerim, or how to take care of the chamrim. And then the first thing, then I look into the another chapter, which is the like conclusion of that's in the last tantra, which we call the last tantra, the conclusion of fourth tantra. And that said that, and I just write down somewhere here, I don't find right now. It said that I don't find, I put somewhere, it's okay. Anyway, it said that Rimla and Rimla Kabze Tongze Jebrasons. Almost exactly the same thing. So it says Rimla Kabze Tongze Jebrasons means, so when we have that kind of contagious disease or epidemic contagious disease, then we need to, it is crucial to, take care of empty heat and the unripened heat. So that means mamintawa, and then the mamintawa and then kapse, mamintawa, tongse, mamintawa and tongse, the empty heat and the unripened heat, right? So that means empty heat and unripened heat means it's not like regular heat, the heat energy problem. It's not regular the fever. It has influence of wind and bio energy. So we need to take care of that first. So it is like this. For example, if we have like the big fire. If there's a fire is associated with wind, and then there's gonna like get much more bigger and it's very aggressive. So what we need to do first cut the wind. Just cut the supplies of the wind. Like many times the firefighters, they just stop the oxygen and then fire gone. Something like that kind of techniques. And then another thing, the kapse means the unwrapping. Unwrapping means first we need to take care of those cold things which cover the heat underneath. So it is like it is similar to that like when we have a fire under the ashes. When we touch the ashes, we don't feel the heat. But when we touch a little bit deeper, we put our finger deep and it's gonna burn us. So that's why first take out those ashes, and then when you see the fire, and then you can pour the water on it to, you minimize the heat. So that's kind of treatment. It was mentioned in the text. So that way, what we should do is in terms of the giving the treatment or giving the herbs. First, we need to give some medicated tea, which we call tang. So tang is, there are a lot of different tangs. Tang, right? We can call tang. There are a lot of different tangs. Some tang make just, like separate those two energies, which is, what they call the complications, right? Sometimes we call complications. Two disease comes together, that's called complications. So we need to have separate those two and then treat, like individually, or whichever is more powerful, whichever is, like creating the problem, just treat that one. And then we have a secondary problem, so just treat the secondary problem like that. So that's why many tongues, there are tongues, a very wonderful medicine, or the herbs that, like some tongues can do both work. Some tongues can do like all three, like min, du, seba. Okay, first ripen, and then collect, and then destroy the heat. So that kind of thing. So that's why we need to give some tongues. After that, like 1 or 2 days, or one and a half days, and then there are some signs and symptoms that everything collected, everything is like ripened, and then we should give the actual the herbs to reduce the heat or reduce the fever. So that's the thing. And then third one is, because of this fever and because of that virus, it affect our constituent, our lusung, what we call lusung constituent, or our body. So we need to regain our body energy to fight back, to completely fight back the virus, take out the virus from our body. So we need to have a very good source of energy, the nutrition. We also need to have like it was said in Tibetan medicine, and something like that. So that means when we have this kind of problem, we need to have make it full. Stomach always need to be full with the nutritional food, with the energetic food, or with a lot of vitamins, if we say in like today's words. And then we need to also have to drink a lot of waters. The what they call the dehydration is one of the worst thing, because we have some kind of fire energy disturbance or fire energy increasement in our body. So fire always like dry up our waters in our system. So we need to drink a lot of the warm water. And if you have the like the facilities, you can drink the Tibetan herbs tea, the Tibetan herbal tea. And then also that it is crucial to, in order to gain the energy of our physical constituent, or the the power, or the energy, we need to have a very good sleep, or the enough sleep. So sleeping is very important in Tibetan medicine. So those are the like the things that we need to do when we get sick. And then there are some herbs that are like I'm not going to talk that much about those herbs, because like a non-Tibetan medical practitioner doesn't understand those things. Some of the herbs, like in the Western medicine, is similar, that some herbs you can buy over the counter, and some herbs you cannot. Some medicines you cannot. You need to have a prescription, and you need to advise by the doctors on how to take this and how long you have to take. Exactly the same thing. So I'm not talk that much about the medications. And then what you need to do is for my own experience, first thing when I get this infection, and I was thinking, as a Tibetan physician, I always take care of myself. If I have any problems, I always take care with the Tibetan herbs, and because I was trained, in that, and then so, but like second, I think the second day, my wife was also get infected. She also shows all those signs and symptoms, and then she just said me, I say okay, and then she just asked me to call her doctor. That she has her own doctor, and then we called, and then they say okay. So they take a lot of like question and answer. They ask us many questions. Maybe they just fill up somewhere there, and then they give another. Maybe it's hotline and the nurse, and then they take a lot of like question and answer, and after taking all the answers, and then they say okay, I'm not 100% sure, but like 90% you have this infection, because you have all the signs and symptoms that. So what I say, okay, now what we should do? And they say, don't come to the hospital or the clinic, don't come to the doctor, because we don't have any medications for that, because that's the beginning. You know, that time there's no, right now there are a lot of people talking about like chloroquine and hydroxychloroquine and Z-Pak and those things. That time no one's saying this kind of things. And then I said, what should we do? And she said, just stay home. Self-quarantine is important, most important, and then you can do the home remedies. And then I just told them, and then my families are very much scared, you know, like my wife especially, she was very much scared, because we keep hurting, you know, like that. Okay, this pandemic disease is very dangerous. Yeah, we also see some video clips, short video clips, you know, very short clips that people are, you know, like cannot breathe and they are on the, like laying on the street, this kind of thing. So I say, I think it is very important to just make them mentally prepared. So then I say, all right, so we need to talk. And then I call all my daughter and my wife, and we have like kind of family meeting. I said, okay, look, this disease is very, very popular right now. Everybody talking about this thing. Everybody's talking about how severe this is, how bad this is. But I was listening to those like news and then the medical conferences and then doctors, especially I was, you know, from when this disease or this pandemic disease was started in Wuhan, start from that. I was every day I was listening those, you know, like what I was listening is more with the like, you know, like specialized, you know, the people who are specialized in this kind of field. Like for example, the president, the Donald Trump, he put some few people for the COVID-19 task. So I was listening what they are saying, and also on top of that, we have here New York's Governor Cuomo, and he always having the briefing with those what they call the news, the people from the news, and then he has like doctors with him, and then I was listening to those things, and I also read some articles that, and I find out that this is a not life-threatening disease. It's not like cancer. It's not like AIDS, HIV/AIDS. It is a common, or it is the flu, very bad flu. It can spread or it can contagious. It's very highly contagious. And I know that. Then I explained to them, this is not life-threatening. You don't have to scare, but we need to very much be careful, because we have daughters here. This can spread. So we just self-quarantine. We just live in a different room. You know, like I put my daughters in their bedroom and another daughter in the living room, and me and my wife in the bedroom. But I, you know, like we didn't sleep on the one bed. I just let her sleep on the double bed, and then I sleep on the corner, you know, with that, you know, the what they call the one, the mattress. So I self-quarantined, and then tell them to, you know, wear the mask, and we use the common places like kitchen and then what they call the bathroom, and then I, you know, ask them to clean your hands and then put the gloves on and put the mask, this kind of things. And then I explain them detailedly. And then I said, this not gonna kill us, because first thing, this is a bad flu. It's not the life-threatening disease. Second thing, our age group is not in the danger. There's a like some age group like 60s, people like over 60, 70, 80. They are old. They have like already have like pre-existing, you know, problems. When people get old, they have a lot of, you know, like this kind of thing. And then their immune system is low because their age is old. And so they are in, you know, like a more the vulnerable kind of populations, but we are still young, very, very young. And then we also doesn't have any kind of pre-existing health conditions. So we are safe. So we don't need to worry about it, but we need to be cautious, you know, because, and that's why, and after that, when I'm saying those, and everybody relaxed, and then I let them, like, for example, if you guys have this kind of problems right now, and this disease is everywhere. If anyone have this kind of problem, first thing is make yourself relax. Mental calmness is the number one. I have seen, you know, once I, you know, talk on Facebook, I shared my own experience on Facebook. Many people, like around like 50,000 people watching like 3 days, and a lot of phone calls come and they ask me, oh, what you did, and it's my own experience. And I have seen some people, they are getting very much, you know, like fear, and they are like, you know, panic, and they're, you know, like they have very much sad, and they're crying, and then there's, oh, I'm gonna die. And then there was one lady that's my wife's friend. She was calling and crying like crazy. She was, you know, very much pain, and she said, I have like breathing problem. I cannot breathe. And then I say, when you have breathing problem, you should call the emergency. That's what they ask, and that's the most important thing. You cannot breathe in, then you'll have problem. And then she said, I called, they came to my house, they checked me, and they say you don't have breathing. They left. I say, how come they left you? And then she was keep talking, and while talking, I can feel that she doesn't have any breathing problems. I say, are you sure you have breathing problem? She was panic and she was scared. And then I say, okay, relax. First, relax. What you have to do, first thing, you have to relax. Because when we're panic, our brain doesn't work. And then our muscles are getting tight. And then we have this. This happens every time when we're panic and scared and those. And then I was explaining to her, this is not life-threatening disease, especially like your age. Your health is perfect. And we know her, So that's why first you need to calm mind and then make some plan for that. If you have some Tibetan herbs, you can take it. Even if you don't have some Tibetan herbs, it's okay. You can take some hot waters, you can boil some gingers, you can put some honeys, you can do all those things. If you have some soothing balms, you can put around your chest and those things. There are a lot of ways you can take care of yourself. And I was explaining like almost like half an hour. After that, she was much more better. And finally she said, Jujo, thank you. She was like, she's Sherpa, she speaks like a mix of like Tibetan and English. So, and then next day, because it's my wife's friend, we called her and she was perfectly fine. And then there's another young guy. He was like his 30s, like he's maybe like 36 or 7 something. He was exactly the same thing. He was keep calling, asking me, and then I cannot sleep. Then okay, maybe this is something emergency. I pick up, like then I asked him. He was saying that I have a difficulty, like the breathing, and he was showing me. He FaceTimed me, and he was showing. He just say, okay, look, I have this, and then I say, okay, breathe normally, and this kind of thing, and then finally he was relaxed. I say the same thing to the young guy, and he was relaxed. And after relaxed, and he don't have any this kind of thing. So that's 2 examples. So when we have this kind of problems, when we have this kind of the contagious disorder or this kind of situations, first we need to bring our mind down, calmness, and then reason it out why I should fear or panic. So that's what in Buddhism we have like meditations. A lot of people, it's very famous in the West that meditation helps us relax our mind. So there are 2 different meditations. One is single pointed meditations, which we meditate on one single thing, like Buddha statue or something like. Another thing is the meditation on reason, right? That's called what they call meditation of the single pointed meditation and the analytic meditations. Analyze. Why should I scare or not? So then you'll find what it is, then get relaxed. So that's the number 1, as I find out from my own experience. Maybe we're running out of time, so I just do. If we have another another time, and I will explain. Otherwise I'm gonna make shorter. Is that okay? Oh, okay, all right. Okay. So what I did, this is my own experience. At the same time, there are some other people. Some of them are like my client, and some of them are like my friend, and they also have the same problems. And then I advise them, what I did, how the Tibetan herbs and how the home remedies helped me, and they did the same thing. And today there are like almost 9 people. I was thinking 8 people, but when I count each one by one, there was 9. So all of us are very good condition. None of us, 9 people need to go to hospital. And so that's like my story. So how I, know how to take care of myself or my family, like self-care. It is from the Tibetan medical text book. I learned from there. I just utilize those, and then it helps me. Maybe the time is running out. Okay, all right. So I'm not. Yeah. Okay, I just leave there, and then maybe if we have time, and then I will complete. Thank you.
Wonderful. Thank you so much, Amshi Wandila. Thank you. And so Amchen Wangdula his story has broadcast very widely across the Tibetan community globally. In the Tibetan versions of these talks that he's shared, he's also shared a lot about the progression of the symptoms, the progression of how he approached Tibetan medicine. And so it's been an informative case for sure throughout the Tibetan community in and outside of Tibet, and hoping that if you want to hear more, we can ask that in the question and answer session. But for now, we'll go ahead and turn it over. So thank you so much. So our next speaker today is Gomar Tashi. He attended high school in the TCHN school system in India, and then joined Sara College of Higher Tibetan Studies near Dharamsala, where he completed his Bachelor of Arts degree in Tibetan Studies. And Sanjay Tashila then worked as the managing editor of the Tibetan Science Journal at the Library of Tibetan Works and Archives Science Department from 2006 to 2010. In 2010, Emory University invited him to come to the States to work on translation of science and Buddhism as part of the Emory Tibet Science Initiative from 2010 through 2012. In 2012, he moved to New York, where he began studies at the City University of New York at Hunter, where he earned his associate's degree in mental health and his bachelor's of science degree in urban public health. Since 2017, he has worked as care manager for the private agency Care Design in New York to assess, develop, implement, and evaluate treatment plans for populations with intellectual and development disabilities. He also founded the Tibetan Community Health Network in, I believe, 2012, where he's published health information in a variety of formats, but particularly on a website and an app. And that's providing Tibetan communities both inside and outside Tibet with health science news and resources in Tibetan language. So this has been a really important and fantastic development that has been used widely. And he's worked extensively to bring this resource to communities on the issues that are critical for them. So I'm going to turn over the floor to him to talk about COVID-19 in both Tibet and what he's been engaged with there, as well as in New York. Thank you very much.
Also, ready? Okay. Tashi and namaste, everyone. Thank you for offering me this opportunity to speak here at Kunde Wellness. So as Dr. Tawni Tidwell introduced, I started this Tibetan Community Health Network website to impart modern health science into Tibetan language, which is very lack of in our language, to help improve not just everyday life or health, but also enrich Tibetan language itself. So since we first heard about cases of pneumonia of unknown etiology in Wuhan in the beginning of January, I started observing this situation, but did not post anything on our website. Or we have a WeChat group which has like nearly 500 member groups who are also working. Most of them, not most of them, but many of them in that group also works as a grassroots agents inside Tibet, promoting public health in their respective regions. We didn't post anything at that time because it's not something that's openly talked about. And moreover, they reported there are like 44 cases and they all been isolated. And also it was unknown at the time that, you know, it can be transmitted human to human. But then within 1 or 2 days, like that number jumped to 59. And the cause was still unknown, and the question of human to human transmission is raised in the media. On January 7, it is confirmed by the Chinese government that it's a novel coronavirus. World Health Organization reported that its signs and symptoms are pretty much like a flu and all that. So I made a video clip on on the flu, like, you know, what virus causes flu, and how it transmits among people, and how you can protect, how to protect yourself, how to stay healthy, basically. It's a 5-minute video clip. That is the length that you can share video in the WeChat group, and which is widely shared among Tibetans inside Tibet. And some people, they, you know, those who have heard about this new cases of coronavirus in Wuhan, keeps asking me if it's the same to the flu. So I say, like, no, it's not the same. It's a different virus, but how it transmits, or like signs and symptoms are, you know, as long as I know, they're pretty much, you know, same. But then the situation in Wuhan got worse. Thai reported its first human-to-human case in Thailand, followed by Japan or Korea, and then United States started screening passengers in the major airports. At that time, lots of video clips, like very disturbing, rather, like were shared in the WeChat groups. So people were really scared. And there are lots of unknowns, and the climate of uncertainty looms over this outbreak. The rumor thrives, right? So before any cases hit any part of Tibetan populated areas, like, the fear is already there. People are like not exactly on a panic mode, but they're really afraid of that, afraid of the news, and they're worried and quite scared. So we made several 5-minute video clips to explain what we know about this virus, how it is transmitted, and how to stay safe. Video clips were shared in WeChat and widely circulated among Tibetan, but the fear and misinformation kept winning. People tend to listen or watch something drastic, rather. You know, like, most of us are attracted to such things. So I participated in various WeChat groups. Most of them have 500 group members in that, to counter false information that's fueling the fear. And then as the Wuhan declared lockdown order, the fear got intense among Tibetans inside Tibet. And as the fear grows, you know, like, people started selling incenses and different medicines. And, you know, at one point, there was a guy who tried to sell Buddha's statue, claiming that this can eliminate coronavirus, novel coronavirus, and all that. So this fear is really killing, figuratively, like before virus reached there. So my main focus is to bring as much scientific information into Tibetan language, so that people would know what is a virus, and how it is acquired, and you know, how to stay healthy physically and mentally. But the, you know, graphic images and videos keep circulating, and they always win. They always win. But we kept trying. At that time, like, I really felt the problems of powerlessness, as sociologist says, and lack of centralized and reliable resources for reliable source that people can count on. Lack of this thing is putting us in a very dangerous position. Fortunately, if I may say, China locked down, sealed off Wuhan, and then rest of the country took similar measures, and the lockdown order is rather extremely enforced from 3rd of Lunar New Year, which is like end of January. So what I did at that time is try to try to improve, of course, the real scientific data and information about virus. At the same time, try to calm people, like, they're really panicked. And but then my main focus is inside Tibet, Tibetans inside Tibet, and Tibetans outside Tibet are experiencing something different at that time. The virus has not crossed the border that much, and the fear and the tension is not this high at that time. So they all received it differently, of course. And tackling rumors and misinformation sometimes bring you negative consequences, especially those rumors that really stick to our cultural belief. Like those rumors are created in our culture, really sticks in our culture. So when tackling such rumors, you face some difficulties. And then unfortunately, like now we are here in New York City, like we are the epicenter of the epicenter. And as MJ Wangdu just explained, like people literally going insane. Like they're so stressed, so scared of all this. Partially because the numbers are, numbers are very easy to translate, or it doesn't need any translation. People can share, oh, we got this much case and that much, mortality and all this. And then people really don't know the logic behind those numbers, and that they got scared. And once you contract this, like it's, death sentence, they imagine that. So we Tibetan Community Health Network focused on most is, of course, following the news briefing of White House, and also following those major research groups and their publications as much as I can, and also Dr. Tawni providing me all these informations. So we all know that socioeconomic status plays a big role in the outcome of COVID-19, not only this, but especially, on this. So I focused on providing information as well as other solutions, like, helping people, sometimes you just direct them to, the welfare system and unemployment insurance, and so this sort of thing. But there are so many people who can't even maneuver those websites, and so I literally help them to fill out their unemployment insurance, other pandemic reliefs, and all those things. So yeah, that's what I've been doing since January 7 or like January 1st. We at Tibetan Community Health Network. That's it. Thank you so much.
Great, wonderful. Thank you so much, Sanditachila.
That's wonderful.
So we have a few questions that have come up in the meantime from both of your presentations. So thank you. One that I'd like to just start with is that as both of you are reaching out to the Tibetan community and interacting with them, do you have a sense of how many in the Tibetan community are possibly infected or are unconfirmed cases versus confirmed cases? So to what extent it's impacted the New York community? And then what have you been doing to help them to understand both what they can do at home, but what resources they have access to? Sanditachila just spoke a little bit to this, but I'd like both of you maybe to expand a little bit on that if possible. So maybe first, Amchi Wangdula. You're muted.
All right,
You're muted.
all right. Do you mute? Okay, all right. Okay. Do you hear me now? Do you hear me now? All right.
Yes.
Okay. Thank you. All right. Okay. So it is very difficult to, like have a kind of number, because we are here, like everybody is on the spread all over the New York City. But I'm pretty sure that there are a lot of Tibetan people who are infected by this, like pandemic disease. And because when I talked in Facebook when I was recovered, and I shared my personal experience with the public through my Facebook account, through the live broadcasting on Facebook. And many people, they contacted me and they keep calling me, they are leaving message on my messenger, and they are trying to contact me through the WeChat, and there are many. And then most of them are like asking what can Yangdron, can you mute your this thing speaker?
Yes.
I can hear everything. Maybe our viewers also can. So there are a lot of people trying to contact me, and they ask me a lot of different questions. Okay, I have this kind of fever, I have that kind of fever. So I got many calls, I got many messages. So that shows there are like quite a number of people who got infected. And then your second question is the like what I am and what we are doing for them. So as a Tibetan physician, it is always like advice in Tibetan medical book that we have 4 different types of like in terms of treatment in traditional Tibetan medicine. We have 4 different types of techniques, or the categories of treatment. So first is dietary guidelines, like so people, what kind of food you should eat and what kind of food you shouldn't eat, and that kind of thing. So I do this very often because the diet is one of the most important, thing that, one of the most important thing that we, for the survival of human beings. So we eat, different food every day. Some food is very useful for us, and some it helps us. It builds us our constituent, our body, but some foods are very harmful. So when we're sick, at the same, the idea is the same. Some foods are very helpful to get rid of those disease, or to build up your immune system and build up your the constituent, and to fight back those viruses. And some food are very bad, and it's gonna cause you on the more problems. So that's why the dietary guideline is very important. So this case, I always advise people to drink a lot of hot tea. And Tibetan medicine also mentioned the rim chugu chabo, and that means it was said that chugu tricky senju kibuse pegento umi dewata chamba rimse chedun tobarches. The hot water is one of the very good medicine. It was mentioned in Tibetan medicine, the first medicine that we discovered through the nature is the hot water. So when we are maybe before the Stone Age, when we were in the caves, we invent the fire, and then the people eat all kinds of things, whatever they find around them. And then they got the indigestion problems. After that, they try to, treat that. And then they drink the hot water, and it's gonna help them to digest the whatever they have in their stomach, indigested food, it digests. And then they find out it has the potency of, medicinal potency with it. So the hot water is one of the number one, because, it is very common, or it is very, simple way to think that when we have a common cold and, cough and cold, we always drink the hot, not the cold. If we drink the, cold water or eat ice or ice cream and those things, and then it gets worse here. So this time, the disease, many doctors and the scientists, the specialists, they're saying that the disease can, infect or affect the upper respiratory infections. So when we have upper respiratory infections, it's not good idea to take cold things. It makes worse. So I always advise people to drink a lot of hot water. If you have those, Tibetan herbs, which we call thang, it's really good to take it, because it makes, soothing. It also, as I mentioned, it also wrap in those, unwrapped heat, or then tongse, and then mamin chawa, right? That's what which I mentioned, and that's the food part, and then the drinks part, and then the food. We need to take a lot of food that has rich of vitamin and then nutritions, like soups, soups, vegetable soups, and then the soups from the bone, and that's also very good for the wind energy imbalance. That's called reduce mikua, and that's very good. And then we can also, eat a lot of the fruit, and fruit has a lot of vitamins that we all know. And then the vitamin is crucial to build up your immune system, especially vitamin C's and those things. So I always ask people to eat food and then try to eat the healthiest food, get more energy, and drink plenty of water to avoid the dehydration, or make your soothing for your, like throat and those things. Because it's, yeah, maybe, I think there's no problem, people, like, the drinking the water, there will be no problem, I think, because it's very much thirsty. It has the, like symptoms of thirsty. I was very much thirsty during that time. So when we are thirsty, of course we will drink the water, right? So but I said, don't drink the cold or ice water, drink the warm water, hot water, or hot tea. And then the food, like that. And then after that, we have some, if you have some Tibetan herbs, try to eat, try to drink the Tibetan herbal tea and try to eat Tibetan herbs like this and that. I give some names, but some of the herbs not allowed because they need to have some kind of guidelines by a Tibetan physician. But some herbs are like common, like over the counter. Here in the West, they use, the term called over counter, right? You can just go there and buy it. So this kind of thing. And then for like food, behavior in terms of that, like social distancing. But it's, I mean, sometimes, what I'm thinking is social distancing is not a very good word, because people get depressed and people are like, they feel really lonely without any problem. Even myself and my family, and sometimes, some of the friends and, very good friends, very close friends, they called us and how you guys, we heard these things, some didn't call. We feel something, when you're in a bad situation. So social distancing doesn't mean, like you don't need to talk to people, you don't need to call the people, you don't need to write the people text message or email. You can do all these things. It is the physical distance. So I think it's better way to say physical distance. We need to physically keep distance in order to, like stop spreading the germs or the virus to the other people, or getting the, virus. So that's, but you can still talk to your friends, still you can text your friends, still, like you can, like show, like the sympathies and those to your friend, or empathy to your friend. So then I advise people to, okay, now you get it, don't go out. Self-quarantine is very important. If you spread it, it's gonna, like a really big mistake, the biggest mistake. We have responsibility and we have, duty to, like to protect ourselves and also protect other people. So that's my main advice. And then for the behavior, then some like kind of therapies. Since I'm like a massage therapist, I learned many different kind of massage, like Tibetan massage and all that. I always, like advise people to do when you have muscular pains. A lot of people have some very strong muscular pain. I also have that kind of muscular pains. I advise people to do some massage with we have a Tibetan medicine we have called Aru balm. It's like similar to the tiger balm, like it's a soothing balm. In the Western, they call soothing balm, right? So I apply those on the throat, on the chest, the back of the upper back and the lower back, on the ribs, because they all over, the back, front, even the stomach, they are muscular pain, very sharp shooting. So when I have this kind of shooting, I apply it there, I do the massage, because the massage brings our muscle soften. When we're scared, when we're like, when we have this kind of problems, our muscles are getting tight, everything's tight. So we will, experience those kind of tightness. And also it is really, really the bad for the breathing problems. When we're too much tight, our lungs are tight, our throats are tight, our chest tight. So when everything get tight, and then you'll feel tight and you'll feel like, breathing problems. So I advise people to put those balms, or what they call soothing balms, or the Aru balm, which I called in Tibetan medicine, we have Aru balm. So put all over the chest and throat, and then back of the upper back, lower back, stomach, and do the massage. Not just applying, do the massage to break up those, adhesions, or break up those, tightness. So after like 40 minutes, many people, myself and my family also, I did this like after I did this for like 40 or 45 minutes, or maybe like 1 hour, all the pain is gone. And it also helps to, like cleansing our breathing, like what they call passage or the channels in our lung. I just put some here nose, and then deep breathe the what they call the steams. You can pour some hot water in your cup and then put some the soothing balms in it, or you can apply here the nozzle and then breathe in the what they call the steam.
Steam.
It goes there, steam. It goes directly into your lung, and then it's gonna open up those channels. So that's very important. I always keep doing this from the beginning, because I know this time the disease makes the worst condition when you have breathing problem. If you cannot breathe, then that's the worst problem. Even you go to the hospital, even you go to the emergency, there are shortage of ventilations. I have heard this news long time before, like president was saying that, and our governor is saying that, and then mayor is also saying that we have shortage of what they call the ventilations. So that's a big problem. Even you go to the hospital, if they have shortage of ventilations, you need to wait someone to finish, take care, So that's why I advise people to try not to drink cold water or ice. This is going to get more infections here. Then, like it goes down and makes you tighter and breathing problems. And then they did this kind of like therapeutic. And then I think maybe I'm taking too much time. So if Tashi anything to say?
I think we lost some to touch that, but I think that gives us also a sense of some of the feedback that you're giving to those in the Tibetan community, but also those in the wider community to which you have contact, of things they can do at home. That tests are very difficult to access right now in a lot of areas, that you might have a lot of the COVID symptoms, but you might not be able to have access to a test. So to be able to do these great suggestions in home when you don't have any access to Tibetan herbs, and these are fantastic that anyone can make use of. I think Sanjay Tashi just took a little.
I have something to clarify. So maybe when Sanjay Tashi is out, I will. Can you hear me? Okay, good. So I like to make a few comments on Dr. Undula's talk. So it's a wonderful, great information. One of the reasons we invited you as the doctor and also as our physician, as a patient, look, you can take a look. Today we have less people than last few times, but you're taking two people's role, because we invited you as a patient and as a doctor. And also one of the reasons I'm so happy that you explained through the Tantra, through the medical book, because every moment that you're going through the symptoms that you are experiencing as a patient, then you are rooting back, or you are explaining, sourcing back to the Tantras that being explained that for many years ago, which is at least 2,000 to 3,000 years ago. And one of the reasons that doing treatment or understanding this condition through Tibetan medicine is not only chasing the current symptoms and viruses that is being presenting to us, like giving you muscle cramps or giving you chills and body aches. Instead, you are analyzing why you're having those conditions that being explained through the Tibetan medicine really well, which like last time we had a doctor, one of the doctors explained that 3 stages of fevers, unripened fevers, and to the fully ripened fever, to the empty heat. So those are 3 basic stages of heat that is giving us all those symptoms. So working as a Tibetan doctor is like working as an artist. You have to be watching, you have to be looking at each different stages. So I'm so happy that you got back to sourcing back to the root Tantra. So it's not something we invented, but our ancestors actually left us this such a great wisdom to us to practice. So at least we trace their pace, but also we need to develop and also how to say develop and integrate with the modern science to make this even better, to be able to help. And one last thing, what I want to make comment on what you said about social distance. Yeah, the social distance word itself is came up with a really hurry because everybody was in hurry and everybody was messed up. So they came up with this word, but really we need the physical distance, but socially connected. So that's what we need. And a good thing we have a lot of social media, but overusing our social media, also watching the news or from the social media, you also need to watch where your news is coming from. So those are the comments I want to make after I just want to make that more clear. I hope it's a little bit more clear for this part. Yeah, so Sangey is back now. It's your time and my battery is running out. So
I just thank you, Dr. Yangdron. So what I wanted to do is also just remind about the question. So the question is one, how much of the Tibetan community have you seen actually affected, both unconfirmed cases as well as confirmed cases? And the second question is really what you've been doing it. I mean, you've told me a lot about being active and helping dispel some of the fear and anxiety. So what you've been doing reaching out to the community there in New York.
Right. So New York City has around 8,000 Tibetans. In the tri-state area, like more than 10,000 Tibetans. So it's really hard to say, how we don't have any data on this. But given the fact that testing ability in New York City is still kind of poor. For instance, like my wife is a nurse working in hospital treating COVID patients and all that. She's been exposed on March 2nd. And then on March 12th, we called the number to arrange testing. And they took all the records and all that. And then they called us back on April 10th after like more than 3 weeks. So that's how long it takes to get tested in New York. Hopefully things are getting better these days, because the other day we called a urgent care and then we got appointment on the same day and we tested and she tested negative, thankfully. It's same thing. Like I have a friend, she lives in Connecticut and yeah, right. So her 75-year-old mom got sick and then they called. She's been tested because she's 75 years old due to her age. She came out positive, and then herself and her husband, her family actually got sick, and then they called the authorities, or like whoever is responsible for this, but for testing, I mean, and then they said they're not eligible because they're young. So there are lots of people who are not tested, and they have all signs and symptoms, and all those who doesn't have severe signs and symptoms, they stay home and they take all the precious pills, Rinchen Rubus, and the Tibetan medicines. And she said those medicines are very helpful, like in particular symptoms and all that. And I also know some sort of asymptomatic, rather. She tested positive. Only symptom she experienced is like loss of taste or smell. Other than that, nothing. Like she tested positive and she's staying home, and they are her parents and her sister, and they're like three other family members are there. They might have infected, but nobody is tested so far because no symptoms and that. So given this, fact, like there can be lots of people who've been who has contracted the virus but not showing serious symptoms, and there are some cases there, people. Some already died, and some were in the hospital, intubation. So it's hard to say. That's one. Testing is one thing, and another thing is like people still don't understand this. The pandemic thing, like social distancing. They don't understand that. That means that they thought like you just stay home, and then at home like they some people have like over 10 roommates and all that, and not you know, like nobody's guarding your door, so you go outside when you want to go. So they all go outside, and they all go to their friends, and they come back to the same place, and all that. And so it can be I mean, like it's quite safe to say, like, you know, the infection among Tibetan community can be large. And also when I contacted like those who are tested positive or assumed positives, asked if they have wearing the pill, they all said they were wearing, and they're still wearing the pill. And obviously,
Just to clarify, this is the Nakpo Gujor.
Nakpo Gujor, right? Nakpo Gujor, right. So yeah, that is something that people should know, because many things like this can really protect you from the virus, and then they forget rest of the measures to, you know, prevent yourself contracting the virus.
Thank you very much. I think this also leads to another question. So in previous webinars, we've talked about some of the protection pills that are worn externally, not imbibed at all, or you are considered to be through aromatic exposure to be protective. And so many within the Tibetan community, but also around an extended Tibetan, outside of the Tibetan community, have worn these as part of that. So maybe Amshala, you can talk a little bit more about the Nakpo Gujor, and specific to that, we have a nurse in Switzerland, Lopsang, who has also asked if she should wear that to work, or if it puts it at risk to be contaminated because she's treating COVID patients, or if she should leave it at home and only use it at home. Great. Thank you. And please unmute your mic as well. We can't hear you still, yeah. Still can't hear you.
Okay. All right. Sorry, this is me. That's me. All right. So yeah, I just want to add a little bit to the, like how we take care of the people here. So like that here, a lot of Tibetan people, the most of them are Tibetan. There are a lot of people, they keep calling, and they have this kind of fear and signs and symptoms, those, and they're asking about the tongue and those things. And then whatever I have, some herbs, I already distributed to the people, and everything is finished. It's a free of cost. It's a free of charge. And then after that, like Yangdron Sanla, Kunde Institute, she also sent me some herbs, like to distribute to Tibetan community, and even the non-Tibetan people comes. Of course, we will and then I also distributed that, and then after that, Digila Nyarosha Digila also sent us some herbs. I also distributed that. So right now I have some left. It's for the like emergency, and then we are doing our best, and then the Tibetan doctors and my friends, and like all around the world, and especially in the West, like California, they are also supporting me to send some pills. So now we talk about the Nakpo Gujor. Nakpo Gujor is the protection pill. It's not supposed to eat. This is just you can wear on the neck. Some people say, oh, Nakpo Gujor cannot protect you, these things. Yes, that's true. If you don't have any kind of, you have to follow the rules. Everything you need to do, according to the whatever it says, So many people in Tibetan society, many people, we put some protections here, right? Like put the statue, or the Kunga, and or the Tara statue, pictures of His Holiness Dalai Lama, those. These are for protections. These are protections for the one who believes, and you need to have a strong belief in that. And also, not only the strong belief, you also need to take care of yourself. It's not saying that if you wear the Nakpo Gujor, you're not going to get infected. No, never say that. In Tibetan medicine, never say that. This is just extra care, extra protection for yourself. But you need to do the, something that you are supposed to do, like washing the hand, all those things. And so that's important things. And then Nakpo Gujor in Tibetan society, there are a lot of people wear the Nakpo Kujur. So Nabu Kujur is not supposed to eat. Some people eat it. It's not supposed to eat. Just, you know, like wear on your neck, like necklace. And then morning or evening, anytime, like 3 times, 4 times, you can just smell it, you know, like this. That's it. It's because there's a reason, because this pandemic disease it goes through the nostril and the mouth, right? Oral and nostril, and some say it's from the eyes. So when you breathe in those kind of airs, it's purified airs. If there's a germs, it's gonna kill those germs. That's the idea. But I'm not saying this gonna protect you 100%. So we have to know that, right? So that's the Nabu Kujur, and you're not supposed to eat that one. And Nabu Kujur is from India, and some from Tibet. Like this. It also has some kind of belief. You need to have some kind of belief in it. Like, for example, Buddha statue and all this, we wear, right? As a Buddhism, we wear for our protection. And then as a Christian, they wear the cross here, protection, right? And then if you wear the cross here, you just cross the street when the high, like traffic is going on, they're not going to protect you, right? That's so same idea. You can just think like that way. And then other one, oh, you have, okay, all right. Yes, we have.
With the nurse, the question with the nurse, should she wear the Napu Gujo when she goes to?
All right, okay, yes. And I always, advise people to that. Some people say, okay, when I smell the Napu Gujo, I feel a little kind of dizzy. Should I smell that? I say, if you feel this kind of things, you don't do this, because it's all like, you have to use your common sense, because it's very strong smell. Some people cannot resist the strong smell, even the perfumes, some people, there's a very heavy perfume and they feel, like dizzy and those things, right? So same thing. And then the nurse, one who's, I think you should wear, but don't eat. If you don't have any problem when you smell it, just do it. It's not gonna, like get dirty. It's not gonna get dirty. Like when we have, maybe she have that kind of idea because we have some protections, some special protections like Buddha statue. And then we also have like called Jikje Maye. There's some protectors. They are very special protectors, very much, like they went to the very, like specific the initiations and the specific blessing from a very high Lama and high masters. And those kind of protections you need to put on a, very special place or very clean place. And like the different people or the like some people cannot even touch it. You need to keep it really clean in order to that was it. But Nabu which is not like that kind of things. So you can wear, you can wear at the clinic, but you don't give this. Yes.
I think she was worried that treating COVID patients, she might the pill itself might be contaminated by the virus.
No, not gonna get contaminated like that way. No.
So also, since we invited Dr. Wandula for also his patient experience, I was wondering if you could just give a brief recap of the progression of symptoms that you first experienced when you thought you were affected by COVID, and just a chronology of that timeline.
All right. Okay. So it is like that. First, when I noticed, I have some other friends, like when we work together, they are like 3 or 4 days before we work together. And I also check some, patients. I see some patients, maybe from them or from my friend, the one who helped me to set up my center. Our center is moved from Flushing to Jackson Heights, and then we have a lot of things to, fix things up on the inside, dusting and those things. I have some kind of feeling here, like kind of burning sensation or itching. Then I thought, okay, yes, I work in a dirty place. Maybe that's because of dirt, because of the dust. That makes me very much confusion. Otherwise, maybe my family not gonna affect it. And then I just clean my throat. I put some salt and hot water. I just gurgle and clean up my throat. It helps me a lot. And then I went back and to the center to do the rest of the thing. And then my friend, he says, I feel like kind of sick. I feel chill. And then I said, okay, go home and take rest, and I will bring some herbs if you want. Just go home. And then we drop him there. And then the next day he says he's complaining. He's calling me and those things. And then maybe like evening time, my other friend called me, and he also had this kind of. Then I went there. Both friends, I just went there, dropped the herbs there, but I didn't go inside. It's not from that time. Maybe from earlier than that. I dropped the herbs there, and then I come back. And then next day I have kind of like the chill, like shivering, and then feel coldness. And then then it got worse, you know, like more chilling, and then I have some kind of muscular pains around here. And muscular pain is not like, you know, like pain that stays, you know, like long time. It's just shooting pain, you know, when we have like inflammations or pus, you know, accumulation, and then we have a kind of pain, right? Like just shooting and then normal. So that kind of pain. And then I was thinking sometimes I have this kind of pain, some here, little bit. And then I just asked my wife to apply some Aru balm, and she did it. It went out. And then next day, and then I got worse. You know, I have more kind of fever and those things. And then my wife also complaining about these things. And then the first I had the throat problem, itchy, and the kind of a little bit coughing. And then I have the what they call the chill, the shivering, and the very cold sensations. When I, you know, after everything is done, when I look back into Tibetan medical texts, I find out that exactly whatever the text mentions, it went to. When Tibetan medicine, you know, medicinal text, the Gyushi for Tantra said that when the disease, especially the contagious disease, enter into your body, there are like two different ways. One goes through your skin or the, you know, like the pores, and one goes through the nostril and the mouth. So maybe it went through the nostril and the mouth. I have eaten these things, and then it spread to my skin. It says that. It spread all over the skin. After that, it developed in the muscle. It moves through the channels, you know, the body, you know, like we have channels, right? A lot of like, sometimes we call like veins and arteries and those things, but we call as a channel, as you know, overall name. And then it moves through the channel. And then it's, you know, like stick in the you know, the bone. And so we have also have a kind of little bit, you know, like pain, but it's not very, you know, like noticeable. And and then after that, it says it's goes deeper into the our organs, especially the solid organs, or especially the viral organs. And yeah, we have like lung problems. You know, after certain times, I feels the tightness of the lung, and I cough. And when I'm coughing, I have like burning sensation over here, and not only here. The regular, you know, the what they call the flu or the cold, when you cough, we have burning sensation here. But this time, maybe it's passing through the channels. When I cough here, the burning sensation goes all the way down to the, you know, finger and the, you know, like leg. It spread, you know. So this kind of thing. Then the last, it will drop into our hollow organs. Yeah, that's also, I showed that, you know, I have seen those symptoms, because many people after certain times they have like diarrhea, you know, not very, some have severe diarrhea, some have just mild, and some have like kind of bloating. And then I had a lot of, you know, like when this began, I have kind of bloating and like too much gas, this kind of things. And that, after that, when everything is, you know, like gone, all the symptoms still have a little bit, you know, like loose motion, not very heavy diarrhea. So that's, you know, the stages. And then what happened, then I drink like Tibetan medicated tea, you know, the medicine tea. And then after that, I eat some Tibetan herbs, which we call gurkyung. And those two are very effective for me. And I didn't have that much high fever. And then I took, there's the Tibetan medicine called Tashi, that's for fever, but that's like a prescription, you know, you need to have a prescription from that with doctor. And then I just took one dosage of that. I don't need to take that much, but my wife has a longer period of fever, you know, it stays there. I give her the medicine tea, and other one, it doesn't help. And then you know, like second day, or I think third day, I'm not sure, quite sure, but I called my friend, the Kalzang, you guys know that, and then he has some of the herbs that I want, you know. He sent right away, and 2 days later I received that, and then I give to my wife that thing, and maybe like 3 doses, then her, you know, the fever is gone. And I know that from my own experience. Also, the nurse on the phone, they also told me that you should check your the what they call fever. Then I check fever, you know, like every day, like 4 hours, 5 hours, I check one time, and then I write down everything: name, date, fever. I write down this one, and then you know, my wife's fever, you know, slowly it went away. It didn't come back. You know, they say that 72 hours. And I also checked that that's what they say, and it also, work like that way. Everybody like that. Then my wife's sister also got some problem with the fever. I give that medicine, herbs, and then after that, the fever, went away. And after when the fever is reduced, if it doesn't come back, then I noticed that then every day by day, we are, like improving. So that's what the nurse also say that. And then what happens? And then I have the last, when I was, recovered from that. And then I had some kind of little bit diarrhea. And my little one also, my little daughter has also kind of diarrhea. We took some different herbs, and 1 or 2 times it went away. My wife has a headache. Everyone is different. And that time, same time, we have, not only my family, I have some friends and some of my relatives, and some of them my patient or my client. And then they also having the same kind of, stages like this. And then they all have not exactly same symptoms and signs and symptoms everyone has. Some, have more like headache, some they have more diarrhea, and some they have this kind of things. So those are the signs and symptoms. And then after everything is gone, all signs and symptoms gone, we are perfectly fine. I went to the Almus Hospital to check the nasal things. And then I just want to check, it was from me. I spread the disease in the family, and they get sick, and I was the first one to maybe it looks like I'm the first one to recover, and I'm quite strong that time. And then I went there, and next day I took the families to check these things, and my result came negative. And then the next maybe 4 days, it takes 4 days to get the result, and then I checked my families, all are positive. And then I called them and asked them what happened, because they don't have any signs and symptoms, they don't have any problem. And then I'm the one who spread them, and I know that clearly, and I have the worst symptoms and problems, but my results showing the negative, and these are my families are like positive. And then they say maybe there's a trend. They say there's a once that virus get into our system, there may be something left behind that. That's why when they test it, maybe it catches those. Or they say another word, maybe they are too early to do this. Maybe let's wait a little more. And then the third option, they are also unsure about these things. Of course, because it's a new disease, new study, everything. So there are a lot of things we don't know yet, but this is our experience that. And then they suggest me. Then I say, okay, what should I do? Maybe I was thinking, I heard that there's what they call the antibody tests, and something the last time, last Monday, the president was talking about that, the antibody test. And then they said, we don't have right now, it's in the process, we may have this one. So maybe it takes an experience, they say. And I heard, since I'm talking to in the WeChat and the Facebook, and a lot of people just contact me. And one of my friends, he's also Imchi. He says that a guy in Switzerland, he also comes positive. And then in the China also, there are a lot of people, they get cured. I'm not saying they cured. They're perfectly fine. They don't have any signs and symptoms or any problems. But when they test it, it comes positive. And there's the Chinese doctor, one who is TCM, Chinese medicine, and also one who says that Tibetan medicine works perfectly. Tibetan medicine helps this virus. Like in 2003, the SARS, and this time also Tibetan medicine helped many patients to recover. That kind of things he said. And he said that once you don't have those signs and symptoms, any problems, and that means you don't have problem. But when you test it, and it tests many times comes positive, it will stay a long time. That's what they say. This is just collective informations. And I think maybe that's your that's your question. I'm taking too much time.
And so this is one thing that we do see. We do see a lot of false negatives as well. We have a 76% rate of this, and also that many people, you won't have any viral load that they're testing, but your antibodies. So that's another test that people can check later afterwards. So that'll be great to see later. And you can also become a blood donor. So that'd be really wonderful.
Yes, of course. I'm very happy, more than happy to donate my blood if it can save someone's life.
Wonderful. Sunny Tashila, was there anything else that you wanted to add to the conversation?
Not much, but through of this pandemic, like right from Wuhan to now, what I observed is like in our society, not only in our society, like in many society, like sometimes like of course we all wants to help, right? We all wants to help people, but sometimes like some word choices, like when you talk to people, when you speak to people, like sometimes like we mystify this whole thing, and then it really interrupts, like people to understand the nature of this virus, how this is acquired, and how to prevent yourself from contracting this. And then right now, MD Wangdu is he shared his personal experience and how he treated himself and all these. These are very wonderful, and the fear that people are experiencing is not asymptomatic or like very less severe symptoms. People afraid of severe symptoms like that end up intubation and on the ventilator and all this. So when we talk about benefit of home remedy or certain treatment, we should define those. We should have a clear cut about these categories, like asymptomatic and very less severe symptoms, and then those who has severe symptoms. And also it's very important to, of course, biopsychosocial model is very popular. It's true. It's effective and all that, but we still should focus on the biology of this virus, and that's, I think, very important. Otherwise, people, there's so many people, they really don't understand what social distancing really means and the purpose of social distancing. Otherwise, as a society, we are not really equipped to such crises, and due to the climate change and excuse me, all these, like lots of glaciers are melting in Tibet, and there are lots of articles on this, like there were 1,000 or over like 10,000-year-old viruses like buried under the glacier now coming up, and there are lots of minings and all these new viruses and those things. This will occur more frequently from now on. So we really should focus on educating the public to understand this scientifically. I think this is very important.
Thank you very much. So I think we've heard some fantastic presentations today, particularly in terms of what's been happening in New York. And so Dr. Wangdu shared his own personal experience as a patient, as well as a physician in the Tibetan medical tradition of treating patients, of introducing the Tibetan community to home remedies, as well as remedies that they have access to through Tibetan physicians. Sanjay Tashi also talked about tracking the COVID-19 both in Tibet as well as it hit the US soil, and helping the Tibetan community have access to all this science material in Tibetan language, to have access to reliable sources of transmission, of understanding the disease, of understanding how one can use preventative measures as well. So I'm going to hand it over now to Dr. Yangdron Kasanla for the concluding words. Thank you. So just unmute your mic, Dr. Kasanla.
Yes. So first of all, I would like to thank you all the speakers, including Dr. Wangdu and Sangey here, and all the people behind scenes doing this editing and the computer work, as well as our old speakers from last few times. Everybody's generously spending their time and precious time and the wisdom with all of us to share this, to share at this stage to benefit anybody who is suffering. And again, we talked about social distance earlier, or the physical distance, socially connected. that terminology actually in Tibetan through the Nyemring, it was already existed. It wasn't something we just started using this word through the Western medicine, through the public health this time, or maybe even a little bit earlier, but just let you know, this is one of the methods that in Tibetan medicine also use for people to get isolated. So I want to let you know this. And so to the point last stage that Dr. Wondula was explaining, you know, Dr. Sangela, we're talking about now we did the underground work in New York City at the Epic area. On this Sunday morning, we're going to talk about the situation and what are the cares and treatment, what work have they done through the public health and through Tibetan medicine, both standard in Amdo, northern part of Tibet. There will be, we have a school of Qinghai University with some of the professor, Dr. Kuncho Gertsen will be leading, who is the PhD at the public health through UCLA. He will be doing the leading the group. So we will have a dialogue and a conversation. And I'm so happy to be here, and I hope to see you next time on Sunday morning at 7 a.m. in California time, right? East Coast will be a little better. But yes, Dr. Undula has something to add in.
All right, just 1 second. Oh, it's good. Now you hear me?
Yes.
Now you hear me? Okay. I just have. Can I have just a little bit time? Just a little bit. There's I have one very important things to say in a very like few words to the viewers, because especially this usually I talk in Tibetan and not much in English, so there are a lot of like Western viewers. So that's why I just want to say something a little bit about like sharing the knowledge. So I just want to like I thought there's like the time left, that's why I waited for that. So now what I'm gonna say is that today we share the virus, right? We share the virus. It was started in Wuhan and then it went all over the world. We shared, whether we like or not, it's connected, all connected, whole world is connected. So we share the world, the virus, we share the suffering. But so just live this as our experience. So I think it's good to share the knowledge and share the experience, share the ideas, like Eastern medicine and then Western medicine, which we call like integrative. So when this kind of time comes, when this kind of pandemic, or when this kind of the worst time comes, there's no much time to search something new, because we have no time. We need to save the people, we need to save save the lives. So why don't we look back into the history? Why don't we look into those old texts, those traditional texts? Just I think it's like many times we call research means something that's already done, and then we will research again. So that's why I think from this experience in the future, we can like for example, we share the virus, right? Now we can share our experience, our knowledge, Eastern knowledge and the Western knowledge. And then there are wonderful things in the old text, the medical text, not only the Tibetan medicine, TCM, traditional Chinese medicine, Ayurvedic, and the Unani, and all those, the ancient medical texts, because those are the ones. Can you mute the? Yeah, those are the ones already. Those are the ones already people use it in the in the history, and those the knowledge which they put into the text are accumulation or the collective knowledge from the past. So that's why it is very crucial to to try to find the new herbs or new medicines, but at the same time look back into the history, look back into those old texts, so we can find it. But our aim is to help the the people who have the problem, to save the life. So that's why the integration or the integrated medical system, we need to have that kind of things, when this kind of, like problem comes. So that's my request. And then many like the people in the West, who are interested in the traditional medicines, they should, dig into that, try to find some information there, and then, like research it. If it's help, then we use it to save the people's life and to minimize the suffering. So that's what I want to say. Thank you so much. I take extra time, sorry for that.
I also just want to clarify, we just received a comment on Facebook asking if Dr. Wangdu was claiming he had COVID-19 based on just symptoms. And so just to clarify, no, it's without a confirmed diagnosis with a test, we can't make that claim. But it's important to share also these stories of people who have not been able to get access to tests, and what people can do, what people are doing for care at home in the case that they might have been infected. And in the case with Dr. Wangdu's experience where his family did test positive, but he didn't, and assuming that he might have been the vector to transmit the virus. So these are all stories that are important. And I think as we're moving into a time where we're starting to hear more of these stories, where we realize the inaccessibility to tests, that a lot more of the research community is looking at how do we tell these stories when we don't have access to test results to see what people's experiences were during this time. And also as follow-up, as we get access to more tests, that now the NIH has launched this 10,000 person access for people who are asymptomatic or who never even assumed that they had the virus, to see how widespread the virus has been transmitted, how many are asymptomatic, how many are symptomatic but maybe never were actually tested, and so forth. And so these are through antibody tests. So I would just want to then transition then to just something that we are going to view over. I'm going to share my screen here. And this is just an important disclaimer that the content in our webinar and that of the Kunde Institute does not provide medical advice, diagnosis, or treatment of COVID-19 or other biomedically recognized conditions. That the perspectives shared here are those of the individual presenters and are for information purposes only. So in this webinar, the Tibetan medical perspectives presented are for supporting a condition which we call Lote Nyerim, which has signs and symptoms similar to COVID-19, but is not identical. So Lote Nyerim translates as infectious lung he, or is a highly infectious condition causing inflammation to the lungs as understood in Tibetan medicine. So many of the preventative approaches that you heard, many of the different formulas that have been presented in previous webinars as well are really looking at this condition that's recognized in Tibetan medicine, but doesn't translate necessarily to COVID-19. So please be advised that these perspectives are not claiming to prevent, diagnose, or treat COVID-19, are only discussing these supportive therapies for this condition, the Lote Nyerim. And that any traditional Tibetan herbal formulas that have been discussed in this, we didn't discuss as many in this webinar, but in the previous webinars particularly, have not been approved or investigated by the FDA. So they're formulas that are formulated according to tradition only. And Tibetan herbs provided by Tibetan practitioners to ease any of the symptoms are not those traditionally used, are those used to traditionally treat regular colds, flus, and contagious diseases, just as Dr. Wangdu had presented from the Gyusi and the Mengat Lentap. And to understand that these do not prevent or treat directly COVID, that these are supportive, again, formulas, and that anytime you take a Tibetan formula, please do so under the guidance of a fully trained Tibetan medical practitioner. And with that, I'd like to thank you all for joining us today, and I'll turn it on to Dr. Kalzang to just say the final words. Oh, Mike.
Sorry. Yes, so we are putting this great opportunity for people to hear, to learn, so we can expand research, because we are lack of research on this area. And so this is our final goal, really. If we can expand we can contribute the Tibetan medicine knowledge into this hardship, the world hardship time, that we can expand the research opportunity, then we the doctors, whoever is included with us, we will be able to help to assist doing more research and development. So thank you so much. This is the main goal of Kunde Institute and all of us. And thank you so much, Tawni, doing great and wonderful moderating job today. Thank you. So we will see each other on Sunday morning. Yes.
Great,
Thank you for the both speakers. Thank you.
Dr. Sandeep, thank you so much.